The MSG Advocacy Coalition, which is a collective of NPOs and researchers, is intensifying calls for the approval of the Maternal Support Grant. The organization says poor pregnant women remain excluded from the social grant system meant to protect vulnerable groups. The group also argued that the grant would be crucial to improving maternal and infant nutrition, eradicating the malnutrition crisis faced by the majority of children from poor backgrounds, further stunting development. Of course, let's speak to this now, to the coordinator, Tshepo Mantje. Thank you so much for your time, Tshepo. It's a crucial conversation, particularly looking at the structure of maternal grants. But talk to us about the issue of poor pregnant women not receiving grants. Why do you think it is crucial that we should introduce this new social relief system, if you will?
Yeah, thank you so much for having us, Veronica, and to Newzroom Afrika for platforming these important issues around young children specifically. Currently, the South African government supports 267 billion rand towards social relief grants. These are for elderly people, people with disabilities, and so on and so forth. And this is a very good thing within the South African state in that it is aligned with the constitutional principles of Ubuntu and social justice. But a big gap that is currently remaining is supporting pregnant mothers. When we look at early childhood development and how people develop to become who they are, the research shows us that the pregnancy period, particularly we phrase it as the first 1,000 days, which includes pregnancy and the first 2 years of life, being the most important time in a human being's life. Through their cognitive development, physical development, and every other element of their development is really shaped in this key time. But what we find is that support from the state only kicks in once a child is born, but also the child has to be registered. And what we are finding with the research that has come out is that 50% of children under the age of 1 are not yet registered or receiving the child support grant. While the mother is pregnant, those who have been pregnant will know, or those who have had family members who have been through this will know that that time requires a lot of support, particularly around visits to the clinics or hospital, nutrition, and other things that you need to sort of give you peace of mind. And we find that poor women in informal rural communities are the ones who are not able to get that crucial support in the pregnancy time. So having something like the Maternal Support Grant would directly support that gap.
Let's talk a little bit about setting this up. We know that having a grant system requires money, and a lot might say that this is just perhaps maybe another burden on the taxpayers. The proposal of this maternal support grant would cost, as you've said, about 2 billion a year, but could save the state 13.8 billion in public health costs. How does that work, and how is this considered cost effective?
Thank you for that question. Our point of departure has to be the recognition that social justice is what we need to address here. And South Africa has committed itself to addressing the injustices of the past and particularly supporting people in poor communities and vulnerable groups. And in doing so, we have to map out where the support is needed, and pregnant mothers being that space. The NGOs and researchers that have come forward with this particular campaign have found that this is actually an affordable endeavor that can take place, because to ensure that about 800,000 pregnant women, are supported financially every year for the period of 9 months of their pregnancy, that would cost 2 billion rand. And that would only be 0.1% of the current spending on social grants. So it's not even a big bunch, a big part of what we are putting aside. But I think even more importantly is to recognize that if we are not supporting the pregnant mother at that stage, we are going to end up paying a lot more in social costs, fixing social ills, and then also around health outcomes of the young child and the community as the child grows to be a contributing person to the community. What the research shows us is that if we invest 2 billion rand now for the Maternal Support Grant, we will get 13 billion rand in return from the money we have saved from the health issues that we will have avoided by having addressed that challenge at the beginning. And another point I want to add here is specifically around stunting and malnutrition. The recent Thrive by 5 index revealed that 1 in 4 young children are experiencing stunting, which is extreme malnutrition. And we often speak about it affecting the physical body, which is part of the consequences, but also it affects the cognitive development of the young child. Meaning when we're seeing young children not being able to read for meaning in grade 4, or we're seeing 36% of dropouts by grade 9, much of that can be addressed if we're ensuring that young children are not stunted. And the first 1,000 days are important to address stunting. And if we don't fix it in the 9 months, we will spend generations fixing this problem.
And so the argument there is better we help these mothers and these unborn children now to save the government from having to, of course, then use other programs, more money to fix what could have been rectified in those early days. You speak about 800,000 women. Who are these women? And I want to say that because I'd like to know who would be the beneficiary, essentially, of this MSG.
It's so important that we put a face to this 800,000 women. And these are women in rural communities, in deep rural Eastern Cape, in informal settlements. These are women that have not benefited from this amazing constitution that we have, the fruits of the constitution that we are still trying to address right now. So in understanding this situation, Veronica, it's actually about understanding it as an issue of equality and addressing issues that are deeply rooted in South Africa. So when we are talking about addressing this issue, it's really recognizing that we are trying to build a nation. And in doing that is recognizing what are the elements that build a nation, and early childhood development is central to that.
Yeah, well, some critics argue that giving this type of, outcome to pregnant women would create a dependency culture. Would it not be better to improve other systems? You speak of nutrition. Should we not, then improve our feeding programs, our nutrition programs, improve our social relief grants, as well as those that are already existing? Of course, given the fact that there is already that issue of dependency on the government.
Yeah, I appreciate that you bring that up because it is a critique that people bring up that young people might just get pregnant because they want the money. However, there is no evidence that shows that if other grants have allowed way for people to do things to get that grant money. Additionally, I want to use a metaphor, if you will, is that if you are guaranteed that 4 apples will rot from the tree you plant, it does not mean you don't plant the tree. Yes, we might have instances where people are taking advantage of the situation, but those will be those will be isolated far and few between. The people who would benefit from this maternal support grant would be way more far-reaching in terms of supporting mothers, but also supporting communities and the development of the Republic.
Well, thank you so much for that conversation. I think it is something to consider, given the fact that we face so many people who are in situations of vulnerability. All right, that was, of course, the coordinator at Right to ECD, Tshepo Mantje. Thank you for your time.